Hello, dear friends, I'm with you, Sofya Dorinskaya. I am a psychiatrist and the head of the Medical Information Center. Today I want to talk to you about the topic of taking immunostimulants. These substances are sold in pharmacies without a prescription. And somehow it has happened that people believe if a substance is sold without a prescription, then it is a safe substance and you can buy it, take it, and even give it to children. And everything will be fine, wonderful, and great. You don't need to go to the doctor and can treat yourself at home. Today I will tell you a story that happened several years ago. This story was told by a doctor when he visited his friend. The experienced medical pathologist suddenly saw a very beautiful and remarkably young woman lying there on the cold dissection table. He asked what is the diagnosis? And the pathologist said that this woman's diagnosis was systemic, red lupus. The story is this. This is a young woman who was 27 years old. She was very successful in business, but naturally she also worked very hard. And she felt as if her immunity was decreasing. She had less energy, she started getting tired, and she always wanted to lie down. She began to be plagued by some kind of semi-flu-like conditions. And she realized, I need to stimulate my immune system. She went to the pharmacy and bought an over-the-counter immunostimulant. 3 months later, this girl came to the doctor with a pink butterfly-shaped rash on her face. A pink butterfly is a symptom of systemic lupus erythematosus. And a year later, this girl died. Her kidneys failed, and in general, the outcome was tragic. What happened? What actually happened in this case was that this young girl, completely without knowing the risks involved, repeatedly stimulated her own immune system by using various immunostimulants. Consequently, this overactive immune system became confused and began a process where it started to aggressively attack and destroy the body's very own healthy cells and tissues. And the consequences of taking immunostimulants like this without a doctor's decision, without a justified decision to take such substances, especially with prolonged use. These are not just vitamins, these are serious medications. The consequences can be fatal. That is, no one will be able to stop this immune collapse when the immune system goes out of control and starts destroying the body's own tissues. And the stronger the immune system was, and the more, so to speak, incorrectly it was handled, the more powerfully it turns its strength against the person, and the person can die. What I want to tell you, my dear viewers, pharmacies exist for doctors. You must not, without first consulting a professional doctor, even in cases where the medication is sold over the counter. You must not simply take medicine and use it whenever you feel that something might be wrong with your health. My dear friends, I want to share that the only natural substance you can safely use for yourself and your precious children, especially in those difficult situations when you truly feel that your immunity is becoming weak, or when you simply have no physical strength left, when you feel that small wounds are healing far too slowly, or when you feel this way in general, when you notice that your face has turned a dull gray color. You know, that specific kind of exhausted and tired shade that we all recognize. This is the moment when you need to take extra care of your health and well-being. You could say yes when you feel that you simply have no energy and you feel that you need something. You feel like you need a little boost, just a bit of stimulation. Then the solution is not the immunostimulants sold in pharmacies, but vitamin C. This is primarily because vitamin C is the essential nutrient that gets depleted most rapidly. Whenever a person is feeling quite sick, or is experiencing various kinds of physical and emotional stress in their daily life. These include psycho-emotional stresses related to the weather, heat or cold, as well as work-related stresses. Certain situations at work, working in hot workshops, being a pilot, or a miner, basically any exhausting labor, or if you work on a rotational shift somewhere. This also includes demanding intellectual work, when you have to make truly brilliant decisions at your job. All types of stress that involve the adrenaline system, adrenaline regulation, all of that is consumed here, vitamin C. And there really will be consequences. Apathy, lethargy, bad mood, the desire to just lie down, slower healing of wounds and cuts. And these are all signs of vitamin C deficiency. I want to quote Lepsky again regarding what they write about this. If, as we have seen, infections lead to the depletion of vitamin C in the body, then on the other hand, a state of vitamin deficiency causes a drop in immunity. We end up with a vicious cycle. In other words, infections lead to a depletion of vitamin C, and this very depletion of vitamin C in turn causes another drop in immunity. Indeed, it has now been established that vitamin C deficiency leads to a decrease in the bactericidal properties of the blood, a reduction in antibody production, and a deterioration of the body's immunobiological state. The vicious cycle that an infectious patient thus falls into is especially dangerous if vitamin C deficiency was already present at the onset of the infectious process. The increased consumption of vitamin C during infection exacerbates the deficiency. This in turn weakens the body's defenses, having an adverse effect on the course of the infectious process. This is a vicious cycle. This vicious cycle can be broken by providing the body with an abundant supply of vitamin C. The only safe remedy you can use as a substance to boost your immunity is vitamin C. You can use it either in pharmaceutical form by buying it in those jars in tablets, or by making a solution, an infusion of rose hips, as described here by Levsky. And I also want to read you a quote from a reference book on vitamins by authors Shailov and Yakovlev. This is my recent addition to the library. Their quote is in the section on vitamin C, page 67. It is known that the entry of a pathogen into the body does not always lead to the development of disease. According to modern understanding, the infectious process is a reaction of interaction between the macroorganism and the microorganism. At the same time, the development of the infectious process directly depends on the body's ability to successfully respond with its defense mechanisms. That is, how well your body resists an external attack by a microorganism, depends on your body's ability to defend itself. Practically speaking, and I quote, "A practicing physician must keep in mind that the state of vitamin C balance has a significant impact on the body's natural resistance to infection." So, dear doctors, if you have infectious patients in your practice or department, patients with any form of inflammatory disease, flu patients, or even measles cases, then vitamin C must absolutely be included in your patient's treatment regimens, because if you don't include this vitamin in the regimen, your patients will leave you with vitamin C deficiency. And they will continue to be ill, and nothing will be able to stop this illness because its cause is vitamin C deficiency. My friends, I hope this message will help you. And please, when you go to the pharmacy, be very careful about what you buy without a doctor's prescription. And most importantly, be careful about what you give to yourself and your children. And please remember, immunostimulants are medications that should only be used as part of a treatment plan prescribed by a specific doctor who monitors the process and knows what they are doing. They are by no means substances that people should be buying on their own, just like that in pharmacies, or taking them simply because they are sold over the counter. I hope I was helpful to you. This was Sofya Dorinskaya with you. All the best. Goodbye.